This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're glad you're with us today. Today, we want to talk a little bit about health to home and a medical respite program. We've got Ryan Haley with us today, who runs the Health to Home Medical Respite Program at Texas Health Resources. Ryan, welcome to the show.
Hi, thank you so much for having me on. This is really awesome.
You know, our listeners out there may not know exactly what we're talking about. So can you give a little background about the Health to Home program and how it got started?
Yeah, absolutely. This is actually a pretty common question because it's a pretty new model. But, Texas Health Resources is always looking for initiatives to improve health in the community. And so, we've seen over the last 3 years increasing numbers of people experiencing homelessness in the North Texas area. Overall, the outcomes are worse. They have longer hospitalizations, more episodic care. So we knew this was a problem that needed to be addressed, but it really wasn't something that, Texas Health could take on alone. So in 2020, Texas Health Presbyterian Dallas teamed up with two other nonprofits, which are the Austin Street Center and City Square, which is our housing partner. And we formed the Health to Home program, which is a medical respite program. So basically what we do, and all of our funding comes through the Texas Health Foundation, but we're able to give men who are experiencing homelessness or imminent homelessness a place to heal after they leave the hospital, where they're also kind of plugged into medical behavioral health care as well as social services, to just give them a safe place to be while they're recovering. And, the ultimate goal is to find them permanent housing once they're on the mend.
So how do you select the clients that participate in this program?
It's kind of been an ever-evolving thing. We started just taking referrals from Texas Health Dallas and from Parkland, but the word's kind of spread. So we've since seen a lot of different clients from other hospitals in the area, and I even had some homeless outreach organizations in Dallas and Grand Prairie reach out and find clients who are unsheltered that were in need of medical respite care as well. So basically anybody that we find who wants to take charge of their health that needs shelter, we try to make it work with them.
Is it fair to say that your clients, for the most part, are homeless?
Yes. Basically, any homeless clients that are suffering from either chronic medical conditions, so anything like diabetes, high blood pressure, congestive heart failure, we've had clients on dialysis, anything that could be life-altering or life-ending without regular care, are folks that we see in the medical respite program. Others we get that are either experiencing homelessness or just the circumstances of a major medical event have led them to homelessness. So, major emergency surgeries, major traumatic events. Some of our clients have experienced strokes, things that can be really life-altering for them and sometimes just have put them in these circumstances where they're unsheltered. And so we get them in, help them manage those conditions and recover, but also provide shelter. We actually saw a lot of folks back in February that were dealing with amputations after being outdoors in the February storm, including a young man who had to have both of his legs amputated. So he was able to get his prosthesis, get therapy, and he got housed a couple months ago and is doing really great. So we're really proud of our clients.
This compassionate program sounds like it really reaches into the community. To help our listeners understand this, walk us through once a patient is accepted in the program and discharged from the hospital, what happens then? Where do they go?
So we're located within the Austin Street Center, which is one of Dallas' largest homeless shelters. We have a 9-bed unit that's off the major shelter. So as soon as they get here, they get established with the on-site team. So that's me. There's also a medical assistant and a devoted case manager. So we sit down with them as soon as they come in to identify what kind of medical or psychological needs they may need to have addressed, and just kind of work on that multidisciplinary approach to get them set up and get care established here. So we are here on site to help them with their recovery. We also have a doctor with Texas Health Dallas that comes out weekly to see everyone, and we meet with our partners every week to just discuss every case and create a tailored plan for each client. So a lot of it is just medical monitoring support and a lot of education to make sure that they're ready and healthy once they're able to transition to housing.
You know, you mentioned that many of these clients have chronic illness, and also many of your clients obviously are homeless. They have to deal with the social drivers of health. To really help our listeners, though, from your perspective, Ryan, what are truly the unique challenges this population faces every day?
There are so many barriers and challenges that come with just not being in housing and not being able to be plugged into the services that you and I would take for granted. I give everybody the example of, say, if you're hospitalized, have an emergency room visit, something unexpected comes up with your health, or you or I were told, hey, you need to leave the hospital, you're being discharged, and we need you to do something as simple as follow up with a specialist. A lot of these guys don't have a phone, they don't have transportation, they don't have a way to get to the appointment. A lot of the times there's no medical coverage, so a lot of the doctors that we would normally be able to have access to won't see them. And there are communities in there's resources in the community for these clients, but the logistics of getting plugged into that when you don't have a phone, you don't have a way to get around, your health literacy may not be what we would take for granted. It's really hard to do that alone. And so we're just here to kind of bridge those gaps, make sure that we're managing their care when there's longer wait times to access services, and just oversee their recovery and provide support and education, and just make sure that they're successful and don't get lost in the cracks, because that's a lot of what happens with the population we see.
It sounds like this program is only for men.
Yes, that's correct. So as of right now, since they are in a cohorted environment, it's a 9-bed unit. So they're all together in this cohorted living situation. So currently the program is just open to men. However, there is a new shelter for Austin Street that's under construction, and this is a program that will expand to women once that construction is completed. So we look forward to the opportunity to be able to serve more of our community and mix it up, get some women in here too.
We're listening to Ryan Haley, an RN, who is the program manager at Texas Health Resources, the Health to Home Medical Respite Program. And what we're going to hear when we come back and continue this conversation with Ryan is that this could happen to any of us. She'll tell us what she has seen from her perspective next on the human side of healthcare. Stay with us.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. We're continuing our conversation with Ryan Haley of the Health to Home Medical Respite Program at Texas Health Resources. This is a program that helps people who have no home, no place to go, get back on their feet after being discharged from necessary medical services. Obviously, housing is one critical factor. But then, Ryan, how do you get them set up for success?
So we've seen statistics that up to 20% of people that are housed do eventually return to homelessness. So we really just have to take a holistic approach and work with our community partners to make sure that we can break that cycle and really set people up for success. So Austin Street case managers do some amazing work for our clients. They get them plugged into employment. into disability services if that's what they need, making sure that they have an income or just any other resources that they would need to manage and get through every day. So SNAP benefits, they help them with the phone, getting set up for paratransit. Another big barrier is ID. It's hard to get into any kind of housing or any kind of programs really without identification. So they do a lot as far as ID restoration. On the medical side, we just coordinate with getting our clients a medical home and setting up with dental health services and just making sure that they have someone to support them when they leave. And we do a ton of education just to make sure that they know how to manage their medical care, or if they don't know how to manage it, where they could go if they have questions to get help so that they're not just lost out there. And then, we also just have to take an approach of everyone's individual needs. Everybody's challenges look really different. We see such a wide variety of clients. And so some of our clients really need help understanding their medical condition, understanding their health, just getting literacy and just reinforcing a lot of the things that they need to do every day. Others, there's a big behavioral health component, a lot of hopelessness. Sometimes there's substance abuse issues. And so it's really just trying to set them up with how to deal with stress and trauma and giving them access to positive techniques to help them cope when they're in housing. So we do a ton of different activities with our folks that we have in the program. So we have painting, meditation classes. We work with them with journaling prompts, just walk around outside, just try to help them come up with some healthier strategies and replacing negative patterns that they may have fallen in before they got here. So just taking a tailored and personal approach to make sure that everybody feels confident and empowered to take control of their health.
You mentioned you have great partners within the community that you work with. One of those partners you mentioned was City Square. What role does City Square play specifically in this program?
So as our housing partner, they house some of our clients, the ones that do qualify, and they provide a little bit of extra support once our clients have been transitioned over to their housing. So they have a community aid worker that checks on everyone, and additionally they have a nurse and a clinic that our clients can follow up with as well to receive medical care after they leave the sort of everyday support of the respite program.
Do you know any of the homeless trends in North Texas? Because you sparked some things here, like you were just talking about, an artist, a professor. I mean, these are people that had viable careers. Are we seeing more of this, especially in the last 2 years?
I think that this is probably something that was always the case. These people of all different walks of life have been suffering from homelessness, but I think it's definitely been exacerbated by the pandemic. So many people just, not only just struggling with their health and, with funds, but I think it's been a big time of crisis for all of us. And, I know that the numbers have definitely increased in 2021. And so I anticipate that as we're all getting back to normal and recovering from things, that we're going to continue to see a lot of different walks of life that just were not able to fully hold it together during all of this.
Yeah, talk about compassion. I mean, this is just heart-touching. Let me ask you this. Where I'm going is kind of parlaying what we were just saying there, is the distinction between people that are normal, quote-unquote normal. None of us are normal, but, quote-unquote normal, that have just fallen on hard times versus people that are homeless because of mental illness. That is a whole nother ballgame. So are we talking more about the former category than the latter, or are both included here?
Yeah, definitely some of both. We've had, I've met a lot of people here that, were living very full, productive lives and had some event, be that maybe the death of a loved one or, a major medical crisis or just some kind of trauma that has completely sent them into a tailspin, or a lot of people that because they're injured, they're unable to pay for their apartment because they're hospitalized or they have medical bills and they ended up on the street and just didn't even know where to go because they were not used to living that life. And, a lot of the times that can lead to other patterns and just people becoming completely hopeless. And, currently I have a client who's actually about to get housed tomorrow who, when we first saw him come in, suffered from a lot of injuries, had been hospitalized for a long time. And a lot of these guys, it's completely their lowest point. And he came in completely just hopeless and so withdrawn and just sad and broken. And seeing him get excited for housing, seeing him really light up and participate and form friendships with the other people in the program and seeing his personality come out, we've had such an amazing transformation, and it's just a huge gift to be able to be a part of that. But yeah, it's so many of us could be right there. It's so easy to think that this could never happen to you or that what could never be taken from you. But, most of these gentlemen do not anticipate being in this situation, and they're often so overwhelmed when they find themselves here. So yeah, it can really be any of us.
Maybe another offshoot of what the last 24 months have shown us is that not only is our health fragile, but what we thought we had, everything around us is fragile, isn't it?
Yeah, absolutely. I think that there's been a lot of people just really questioning what's important. You see people that have struggled with their health, but you see people that have also really struggled with their livelihood. And a lot of the times those dominoes just fall together.
Is this something that people are jumping on board with you and helping?
Oh, yeah. I've had such a great response from, people, anybody that I meet just out in the community, at the hospital, my former coworkers, everybody wants to know how they can help and how they can get involved. And I've had, I'd mentioned meditation classes earlier. I have a friend that comes in and teaches that. I've had tons of donations of books, just anything that people can try to do to contribute. But I think a lot of the times people don't really know where to start. A lot of people really want to help this community, and, they think that maybe just, good deed for the day, handing somebody a couple dollars, buying somebody food is the way to do it. But, we've really got to shift our mindset to helping people really thrive versus just survive out there.
What are some of the things that your clients, your patients, need to do for themselves to be successful?
Yeah, and that's really what we try to work on. It's really just about empowering people to just kind of understand how to navigate things. So they really just, a lot of it's compliance, but a lot of it's just learning how to navigate the healthcare system. So making those doctor's appointments, refilling their medications, sitting down and really putting the work in to understand their individual health conditions and why it's important to continue to take their medications and make their doctor's appointments, because we're dealing with a population that when you're on the street, you're in a constant state of crisis. And so absorbing any kind of information about your health is really difficult. So, we really just got to shift them out of that state of crisis and get them into a comfortable place where they feel like they can really take that on their own.
Well, you're doing incredible work, Ryan. Thank you for sharing the program with us.
Absolutely. It's been my pleasure.
Ryan Haley, Health to Home Medical Respite Program, Texas Health Resources. When we come back, COVID fatigue and the toll it's been taking on us mentally and emotionally with Dr. John Burruss next on the Human Side of Healthcare.
Welcome back to the Human Side of Healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the Human Side of Healthcare. Delighted you're with us today. And today we're going to talk about the pandemic, but we're going to use a little different approach. We're going to talk about the pandemic and its impact on behavioral health and mental health. We're delighted that we've got with us Dr. John Burruss. He's the CEO of Metrocare Services, does an excellent job here in North Texas, and especially for some of the most vulnerable people in our society. Dr. Burruss, welcome to the show.
Thank you, Steve. It's a pleasure to be here.
Jumping right in, over the past 2 years, and now we're entering year 3, how has COVID-19 impacted your patients?
Well, you just captured probably one of the most extraordinary things as far as an impact is how long this has gone on. This particular challenge to our society is rare. And we don't often step back and think about just how rare it is, that it impacts so many areas of our life. But it's also got some psychological aspects to it, if I could, that are difficult for everybody, including folks who have existing mental health issues. For example, this threat is invisible. Most of the threats we encounter in our life are not invisible. Tornadoes, fires, floods, hurricanes, we know where they are, we can see them coming, and we can, to some degree, know what to do to prevent them or to prevent our exposure to them. But this we can't, or certainly we couldn't when we didn't know as much about it. The length of the exposure is extraordinary, and the messaging has been really difficult as far as its inconsistency. So what that's done is it's created a constant sense of tension, a constant heightened anxiety with all of the internal body-based kinds of things that come with that, the heart rate, muscle tension, headaches, etc. And then that leads to both frank mental illness, anxiety, depression particularly, but also increases in substance use disorder. Including people who are just drinking too much. We often think of, we need to think about substances that are illegal and otherwise, but really about a third of people, I saw a stat the other day, are drinking a bunch more than they did before the pandemic. So it's pervasive. It's affecting everybody, from those who don't have a mental illness to those who already had one before the pandemic started.
How would you rate, just looking and assessing all of your patients, depression in the last 2 years? How much would you say it's increased?
Well, so in our patients, they're probably already seeing us for depression or for bipolar disorder. So what I would look at is our new evaluations. People who have depression have certainly had recurrences, but we've broken records at Metrocare for the number of new clients that we've evaluated during the pandemic. And that's including that we had to go remote for a lot of the assessments. So people overcame all the usual hurdles of stigma and, just difficulty admitting psychological illness in a lot of cases, and approached us in record ways. In the 50-something years that Metrocare has been around, we've never seen numbers like this.
After the last surge, and I'm referring towards the end of the summer and early fall, there seemed to be real hope that we were coming out of this. And then lo and behold, here comes the variant Omicron. Maybe it's too early, but has this negatively impacted people where their hope is diminished again?
Yeah, of course. Of course, when you think you're seeing the light at the end of the tunnel, so to speak, and then it is taken away, then that creates just yet another insult to our ability to maintain our equilibrium. And, Steve, one of the things that's really important to think about here, in the best of times when there's no pandemic, there are certain things that tend to fuel humans. The things you look forward to, optimism, things that you're anticipating, those are the things that often keep us going. So, some people are really lucky and fortunate to be thrilled to go to work. But a lot of people, go to work because they want to get to those things that they're anticipating. The pandemic in many ways has eliminated a lot of those things that people become optimistic and excited about. You can't go to that concert you were looking forward to. The cruise you've been putting off till you retired isn't going to be available, or if it is, it's going to be very threatening to you. The travel particularly has been a challenge, and that's what so many people use. So every time we get a new peak, every time, Delta gives way to Omicron, and now we've got to go back one more time, it's taking away some of that. So you hear the words languishing. Big New York Times article on that just recently. Languishing is the idea that you're stuck. So in addition to thinking about fatigue or just being exhausted and tired from the length and the continuous insults from this pandemic, we got to also think about that what this has additionally done is taken away the things that are often the remedy for that. So we have to look for new remedies. You have to look for transient ways to try to fill in those needs until the world and our societies give us back the opportunities we have used over so many years.
We've spoken about depression, anxiety among your patients. I'm going to switch gears a little bit. Your team provides excellent care. How is your team holding up physically and mentally?
We are fortunate at Metrocare to have an amazingly committed workforce. I mean, we've got people who've been with us decades, and they go out every day to make somebody's life better, and they've been holding up. We're also fortunate in that we're not the front lines of the COVID pandemic. So I have such respect for the people at Parkland and UT Southwestern and THR and all the other places where they're on the front line, seeing the people come in with the virus, where we're managing the psychological and psychiatric aspects of it. So some of the exposure risk that people have to accept as a part of the healthcare system isn't as prominent for Metrocare. That being said, they're tired of it. They're exhausted. They've put in the effort like everybody else. And earlier in the show, we talked about how we're seeing more people and seeing more evaluations than we ever have in the history of the agency. So that's the workforce is having to do that. They're having to step up every day to see record numbers of people. So we're doing what we can to keep their spirits up and to keep the workforce up, because obviously, the other thing that's in the news so much is people are just deciding not to work. And so keeping the staffing at an adequate level has been hard. So we're working on all that. They're doing their best, and I applaud them every day for doing it.
From your viewpoint as a psychiatrist, I'm going to throw a question at you that you probably aren't asked frequently, but the pandemic has created people with their emotions running high. People get angry. I was in a grocery store the other day with a mask on, and a person just walked up and said, "Why are you wearing a mask?" And I just kind of walked away. Do you have any nuggets of advice from a pure mental health perspective on how we try to diffuse the anger that's come about in this pandemic?
That's a tough one. And you didn't mention it, but particularly when there's societal influences that are rewarded for stoking anger, when there's a whole infrastructure out there that benefits by maintaining that edge. How do we do it? So it comes along with the fatigue. We all know that when we're fatigued in any way, when we've had a long day at the end of the day, we're not as resilient. We're not as able to tolerate, to be able to absorb the difficulties of any day. So you're dealing with people in many cases who are at that stage. It's not that they're bad people. It's that they're perhaps misled, perhaps just have exhausted themselves in their ability to be able to continue to manage in the face of this. And so some people are just, aggressive and unfortunate. And I think handling it like you did is great. Others, I think, when you approach it, that they're not trying to insult or assault you. They're also tired. They're also sick of this. We're all sick of it. Everybody's sick of it. Nobody wanted to be here and going into the third year. And so if there's an ability recognizing that you are also sick of it, Steve, and you also don't want to have some person randomly walk up to you. If there's any resiliency there, though, to say, you're right. This sucks that we still have to do it. Maybe that's plenty in that circumstance. And, if somebody's intent on making a big deal of it, then I think you have to, just dissociate yourself and walk away and not engage, because there's no real good outcome there. But if somebody's willing to accept, hey, none of us want to do this, but I'm choosing to. You don't have to choose to. I wish you would, but that's your choice.
Dr. Burruss, this is Thomas. What about the fact that we've been hearing lately that Omicron might become endemic? In other words, it's just here. It's here to stay, and we'll just have to learn to live with it. And thinking about COVID fatigue, how does that impact things?
The more we learn about Omicron, actually, that it may help hasten that, because it's very infectious, symptoms come on rapidly, and it's not as deadly. That's exactly how you would want it to be for this to progress towards endemic. Now, Steve knows you can't overwhelm the hospitals any more now than you could in 2020. And actually, they're more subject to being overwhelmed now because of the same reasons, the fatigue, the things we've been talking about.
We're listening to Dr. John Burruss. He's the CEO of Metrocare Services here in the DFW area, psychiatrist, talking about this COVID fatigue that after 2 years and now rolling on into year 3, are we ever going to get rid of COVID-19? Back with more of Dr. Burruss's thoughts, and then Steve is going to wrap things up with his thoughts on the current situation this week with Omicron next on the human side of healthcare. Stay with us.
Covering the healthcare topics that matter most to North Texas. This is the human side of healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're tackling the mental health side of COVID-19, specifically COVID fatigue. We've all had enough, haven't we? We're talking with Dr. John Burruss. He's CEO of Metrocare Services. Steve?
You mentioned COVID-19 fatigue. To our listeners who probably have COVID-19 fatigue, we all do. Do you have 2 or 3 just points you can make that are some exercises we could do to help us get through this?
Sure. Well, and you just said one. I'm not sure you meant it exactly this way, but I'm going to throw out there exercise. So as humans, the side of us that is prone to ritual is good at that, and it helps us. So being able to keep and maintain a habit of exercise, a habit of sleep. Getting enough sleep is critically important we're talking about fatigue, right? So what is one of the solutions to fatigue is making sure you sleep. Now, how do you do that? Well, one, you got to turn off your devices. So we have all, I think, particularly when we're housebound, and it's human nature. It's innate in us when we're threatened by something to go seek information. The things I mentioned earlier, if there's a hurricane coming, a tornado, a fire, you go seek information. Well, that's the same thing we're prone to do. So, good, we get some information, but once you get to the point where you're doom scrolling, and you're going through your feeds and going through emails, there has to be some limits on that. So having your good rituals, exercise, sleep, appropriate diet, etc., eliminating bad rituals, which I mentioned earlier, drinking, the alcohol use has risen dramatically, so we need to be careful that we're not using alcohol and other substances to try to address this. And then, I mentioned this earlier, we are driven by anticipation. We are driven by a sense of something out there that we're looking forward to. Having those things, even if it can't be a cruise or a trip to, wherever, having things in your life that you anticipate, that can include simple things like a new mastery of something, taking up, knitting or piano or something, anything that gives you some anticipatory feeling. Those are things that are really, really important right now because a lot of that has been at least temporarily taken away by the situation. So whether or not you have major depressive disorder or generalized anxiety disorder, even if you're just unsettled by what's happening, those are things that are really critical.
When patients come in and sit with you and they have a long, extended, ongoing issue in their life, how do you counsel them for the long game? What do you tell them to do for the next 12 months?
It goes back to what we said a minute ago, that you have to get back to, if you've not been maintaining some of your usual routines, They're basic. There's not a magic answer. There's a fundamental answer, which is you need your routines, your positive routines, your exercise, your diet management, those kinds of things. And you need to avoid your negative routines. You need to avoid the things that you know and I know and we know will take us down bad paths. The thing you can't do right now in some way, and it's not as much can't as it was in the freshman year of COVID. But the things you can't do right now are going to pass. You'll be able to get back to those. So you have to get through the 12 months with what you do have available. And it does so many things, Thomas. It occupies your time. One of the things we have right now is we have this time sink where, and by that I mean that we kind of lose track of time. We've got more time in some ways than we had before because we're not commuting, doing some of those things, but also time, seems to be sluggishly dragging along. I mean, so there's all these things with time. You find something to occupy some of that time. That's a very adaptive way to go about dealing with the next 12 months. And that's what you want, is you want things that are pro-adaptive, not maladaptive. Drinking more, that's maladaptive. You doom scrolling, getting out there on your machine and your device endlessly is maladaptive.
John Burruss, CEO of Metrocare Services, thank you so much for your great insights on this very important phase of COVID. And Steve, speaking of, how is North Texas handling Omicron?
Thomas, what a great question. It's difficult to say at this point. I think the next 2 weeks are going to be quite serious. And, I know our listeners out there, Thomas, they're probably tired of hearing about COVID. They're tired of hearing about things we need to do. But, I was talking to a local media outlet this week, and I said, yes, we're talking about the same book, but we're writing a new chapter every day. And we need to deal with that new chapter. And here are some of the things we're dealing with currently. We're having many more cases of the Omicron. As a result, people are coming to the hospital. Many are being treated as an outpatient and going home, but many are being admitted. Many are staying in medical surgical beds. They're not necessarily going to ICU. So it's a lower acuity patient, Thomas, but the volume continues to increase.
All right, now here's the point of confusion for me, because when we talked to Dr. Haley the very first time, the first weekend of this year, the thing that hit the media was that Omicron is spreading faster, but is not as severe. So the idea is, well, if you're already exhausted, as we just talked to Dr. Burruss about how we're feeling collectively about COVID, you're already worn out. And then comes along this variant that's not supposed to be as bad. And then you start reading stories. See, this is that confusing messaging that we've been talking about, is that people say, well, just get it and then you'll have your natural immunities. And yet, from your office and what you see the numbers of all of the 90 hospitals across North Texas, the numbers are going up and up and up, and people are getting really sick from Omicron.
You're exactly right, Thomas, and I know it's confusing. Let me see if I can relay to you what the doctors tell me. First and foremost, Omicron is much more contagious than the much more severe Delta variant. With that said, just the law of numbers, you got more people infected, you're probably going to have more people that have to come to the hospital. That's number one. Number two, many of the people have been vaccinated and they get a breakthrough virus and they're sick, but they're not as sick as they would have been, i.e. Omicron is not quite as serious as, say, Delta, especially if you've been vaccinated. And then I think the third thing overall, Thomas, is if you look at Omicron and you look at some of the symptoms, the physicians have had almost 3 years to know how to treat the coronavirus. And a lot of the techniques they previously have learned, they're using to help fight this Omicron, which is continuing to infect our population.
Okay, so then the reaction, it sounds to me like we should be just as vigilant not to get Omicron as we have been to not get Delta and not get Alpha and all the other ones that we've been dealing with for 2 years. We're back to basically all of the precautions we started taking in 2020.
You hit the nail on the head. I talked to an infectious disease doctor this week, and this is what they told me. You do not want to get infected with Omicron. Even though it may not be as serious as Delta, its fatality rate is twice that of the flu. And as you know, 40,000 Americans die every year from the flu. And they said the best thing to do is go back and roll the clock back to March of 2020. Wash your hands, use hand sanitizer, wear a mask, physical distance. Best tools in the toolbox coupled with vaccines to fight Omicron.
I had a personal friend who got it and was very sick, and she didn't have to go to the hospital, but she said it really messed with her blood pressure, and she said, very sick for a number of days. Steve, just like, wow, will we ever get out of this?
We're going to get out of it. We've got to all work together. We've got to all do our part. I know we sound like a broken record, but we're going to keep fighting the fight and encouraging people to do what they need to do to protect themselves and their fellow Texans. Yes, we will get through this, Thomas. Thank you so much for being with us today. Join us next week for the human side of healthcare.